Hi, I'm Dr. Ravinder. I'm an orthodontist and an implantologist, and I practice at Dentalign, Whitefield, Bengaluru. Why do wisdom teeth need to be extracted? Now, wisdom teeth are typically the third molars which erupt at the very back of your mouth, typically during late teens or early 20s. A lot of the times there isn't enough space in the jaw for these teeth to erupt. Also, sometimes even when there is space in the jaw, the tooth kind of erupts at an angle, and it does tend to cause a fair amount of pain and discomfort. The other problem with these wisdom teeth is because these are not very accessible, you may not be able to clean them that well, and they may impact the tooth in front of it. So that is the common reason for the wisdom teeth to be extracted. Because these teeth are partially embedded sometimes in the jawbone, sometimes they are completely stuck inside the jawbone, the extraction process is not straightforward. It does require uncovering the gums a little bit, sometimes cutting a little bit of the bone around it, and depending on the position of the wisdom tooth, you may need to section the tooth and remove it in pieces. Typically, the process may take anywhere between half an hour for straightforward cases to all the way to about an hour and a half for very complicated cases. There are a few complications and risks associated with wisdom teeth extraction. The commonest side effect or problem with wisdom teeth extraction is that post-procedure, you're bound to have a fair amount of swelling and pain for about 3 to 5 days time, which typically can be controlled with antibiotics as well as painkillers. The more rare side effect is some damage to the underlying jaw structure or to the underlying nerve. Now, this typically happens in very few cases, and more often than not it is reversible over a period of time. Now, in order to evaluate whether there is a risk to the underlying nerve, you need to undergo what is called as a dental CBCT procedure, which has now almost become mandatory prior to the extraction of a wisdom tooth.